Hello, professional nurses. This is Mrs. Ignacio with the next video in the lab value series. So tonight I am focusing on normal lipid panel values. So when we think about the lipid assessment or the lipid profile, that includes the total cholesterol, high density lipoprotein, low density lipoprotein, and triglycerides. So cholesterol is present in all body tissues, and it is a major component of LDL, the brain and nerve cells, cell membranes, and even some gallbladder stones. Triglycerides constitute a major part of very low density lipoproteins and a small part of the LDLs. So increased cholesterol levels, LDLs, which are again low density lipoproteins, and triglyceride levels place the client at risk for coronary artery disease. So increased cholesterol levels, increased LDL levels, and increased triglyceride levels place the client at risk for coronary artery disease. The HDL, which is the high density lipoprotein, helps to protect against the risk of coronary artery disease. So, total cholesterol in our patients, that's what we're looking for, should be less than 200 milligrams per deciliter. The LDL should be less than 100 milligrams per deciliter. The VLDL should be between 2 and 30 milligrams per deciliter, and the high density lipoprotein needs to be between 45 to 70 milligrams per deciliter for males, 50 to 90 milligrams per deciliter for females. Triglycerides should be less than 150 milligrams per deciliter. So please try to commit those values to memory. But let's talk about what each of these values may indicate in our patient. If we're looking at high density lipoproteins, those are your HDLs. Increased HDL levels may indicate extensive exercise or a familial HDL lipoproteinemia. I'll say that again, familial HDL lipoproteinemia. Now remember, your HDLs are your good cholesterols. Now decreased HDL levels may indicate familial low HDLs. Maybe there is a hepatocellular disease. There may be disease of the liver like cirrhosis or hepatitis. Decreased HDL levels may also indicate hypoproteinemia. And remember, hypo means low, so low protein. So this patient may have malnutrition. This patient may have nephrotic syndrome. This patient also with decreased HDL levels may also have metabolic syndrome. So now that we've talked about what the HDLs mean, what does the LDL mean, or what does it signify if the patient has an alteration in these lab values? Well, if the patient has an increased LDL or VLDL, it may indicate that they have increased alcohol consumption. Again, if it's increased LDL and VLDL, they may have chronic liver disease. They may have Cushing's syndrome. They may have a familial hypercholesterolemia. They may have familial LDL lipoproteinemia. They also may have, if they have increased LDL, glycogen storage disease. So this is von Gerke's disease. They may have a hepatoma, and they may have hypothyroidism or nephrotic syndrome. If the patient has a decreased LDL and a VLDL, these decreased levels may indicate hyperthyroidism, a hypoproteinemia with severe burn patients. You may see that in severe burn patients. You also may see hypoproteinemia in your malnutrition patient or the patient who has malabsorption. Decreased LDL and VLDL levels may also indicate that the patient has familial hypolipoproteinemia. So here's some nursing considerations when we talk about our patient's lipid panel values. What we need to consider is that oral contraceptives may increase the lipid level. I'll say that again. Oral contraceptives may increase the lipid level. We also want to instruct the patient to abstain from foods and fluid except for water 12 to 14 hours and from alcohol for about 24 hours before the test. So if the patient has to take their lipid panel value test, they're going for a blood draw, they need to abstain for food and water for 12 to 14 hours, and they need to abstain from alcohol for 24 hours before the test. So this is a fasting test. Instruct the patient to avoid consuming high cholesterol foods the evening beforehand. So yes, they're going to be fasting, but having a Big Mac or a Whopper right before their test the next day is not a good idea. So hopefully you understand a little bit more about the importance of the normal lipid panel values. And we do have a little pictorial of the statins. If you're not familiar with the statins, go ahead, look it up and see what it has to do with the topic that we've just discussed. Remember, always think like a nurse.